Well, children of color get worse health care in this country than white children. This is according to a new study published in a children's health journal.
And here's some of what the researchers found. Children of color are less likely to get diagnostic imaging and painkillers. They're also more likely to experience complications during and after surgery. And they face longer wait times at the emergency room. Family medicine physician Dr. Bayo Curry-Winchell joins us now. Dr. BCW, it's very good to see you today. If you can, just lay the groundwork for us. Tell us about what some of these healthcare disparities actually are, what they look like, and why they exist.
So it's multifaceted. When we look at access to care, whether it's social economics, geography, all of those things really limit our kiddos from really having access to care. And then when you look at quality of care, we continue to see underfunding of hospitals and communities of color. And so when you couple that with medical mistrust and bias, all of that really plays into these inequities that we are seeing in children, unfortunately, of color.
As a parent or a caregiver, doctor, what are the kinds of questions you should be asking your child's doctor about their health to make sure you are advocating for those children?
First, I always tell my parents to make sure that whatever care you're seeking out, that they're accessible, that they're available to, answer your questions in a timely manner. The other thing to think about is asking that doctor, why did you decide a certain diagnosis, and asking why they went through versus ruling something out or ruling something in. Because I think you empower yourself as a parent. That way you can arm yourself with the knowledge of why that doctor chose that plan. So I really encourage parents to ask questions, and also invest in asking yourself, is this doctor listening to me? Is this doctor culturally competent in what things are important to me and my family?
It's interesting you talk about them listening, because it's also about being believed, right? A lot of times we do these reports, these studies on racist practices, and then when they happen in real life, people are like, no, it wasn't that. It wasn't about race. People want to deny that we're seeing what's actually happening with the numbers. So what can parents do to close the gap? But what can other people do to close the gap so that these parents and the families are believed?
Well, first, I think, health education, health literacy is vital. And really being able to know about what you should get as far as healthcare. And then data is so important. When we look at these disparities, it continues to show there is a disproportionate rate of diseases in a specific group. And so when you put all that together, it's easy to justify and highlight that this continues to happen. So I encourage parents to ask those questions and really advocate for the best care. And if you aren't able to get it, continue to seek out different types of care, because your health is your most prized possession, and you have the right, as well as your family, to have the best care.
Dr. Bayo Curry-Winchell, great practical advice. Thank you so much.
And stay with us. You're watching NBC News Daily.